Hi everyone, this is Pavitra, working as an assistant professor in Sri Muthukumaran Institute of Technology in Biomedical Department. Now we are going to see the lecture on Assistive Technology, Unit 1, Part 2 video. First, we will see the core objectives of this assistive technology. To know the hardware requirements of assistive devices and to know about the prosthetic and orthotic devices and to know about the developments and recent trends in the assistive devices. These are the 5 units in assistive technology. Unit 1 is cardiac assist devices. Now we are going to see the cardiac assist devices unit only. These are the course outcomes of this assistive technology subject. After learning this subject, we can able to know these outcomes. Unit 1 is cardiac assist devices. In this, we have seen already principle of external counter pulsation technique. Today we are going to see about intra-aortic balloon pump, that is IABP. It is It is a mechanism that gives temporary support to the left ventricle of the heart by providing mechanical support to the left ventricle through balloon within the aorta. It is a widely available method for supporting of left ventricle. It is a invasive technique. IABP is a long skinny balloon that flows through the aorta, which is a large blood vessel, and inflates and deflates during the heart diastole and systole. These are the equipments used during the IABP surgery. It includes mask, sterile gloves, sterile drapes, and gowns also. These are the components required for IABP surgery: double lumen catheter and the console that regulates the inflation and deflation of the balloon. This is the catheter injection. Next, we will see the preparation of this surgery. Before insertion of IABP, we have to get consent from the patient and we have to check thoroughly there is any infection or any peripheral atrial diseases or some other bleeding. We have to ensure with this, and the patient should be in supine position to before giving any uh, sterile to them. Purpose of IABP treatment is mainly to increase the myocardial oxygen supply and to decrease the myocardial oxygen demand. Indication of IABP: patient with cardiac failure, refractory unstable angina, pre-operative treatment of complications due to myocardial infarction. It is a bridge between transplantation of heart. Effects of IABP therapy: IABP balloon will be inflated during the diastole and deflates just before systole. This magnitude depends on the balloon volume, heart rate, aortic compliances. Inflation and deflation of the patients are synchronized by the cardiac cycle. Inflation of the balloon causes augmented diastolic pressure and deflation reduces the left ventricle workload. These are the IABP during systole and diastole. Now we will see the principle of IABP technique. First one is flushing or pressure monitoring, and second one is delivery of helium gas. There will be flexible catheter and mobile console. The mobile console is for providing helium gas and computer for monitoring the inflation and deflation cycle. This is the IABP console, which is mobile, used to control the inflation and deflation of the balloon during the invasive technique. This is the catheter used for the IABP. The positioning of the catheter should be 1 to 2 centimeter to left subclavian artery. The position should be ensured by the chest X-ray or fluoroscopy. This is the ECG we will get after the surgery of IABP. This highlighted graphs or shows diastole and systole of the heart. We will have some complication after this surgery, limb ischemia or any other internal bleeding or thrombosis or aortic valve rupture. Some other people will get infections also. Thank you. For more videos, subscribe SMIT YouTube channel.